So again, welcome to the NEMSIS public training, um, the July 1st, 2025 training. So today we're going to be kind of getting back to the basics. I'm going to learn a little bit about history of NEMSIS, how everything works. Some of you may already be pretty familiar. Some of you may be a little new to all this. I know that we have quite an array of experiences that of individuals we've been working with lately. We're going to go over the data dictionary as well, learn the components to kind of hopefully offer a better understanding of how the data dictionary affects the EPCR and ultimately your ability as a clinician to document and kind of why it's that way and how it leads to kind of better data collection, data quality. So, for those of you that don't know, my name is Casey. I'm a business data analyst with the NEMSIS Technical Assistance Center. My experience, I have a pretty extensive EMS background. Been in EMS for about 19, almost 20 years now. Started out as a first responder for my local fire department. Just kind of developed a passion for EMS, worked my way up, became a paramedic. I worked as a paramedic for 14 years. I've worked for volunteer ambulance services in rural areas. I've worked for big full-time metro services. Um, Doing everything from 911 to in-facility and critical care. I've also worked as an EMS educator, field training officer, and I was an EMS captain for 6 years at my last job before coming here to NEMSIS TAC. So grateful for this opportunity, and again, grateful for everyone to join us and learn a little bit more today. So NEMSIS, better data, better care, always our mantra. Learning objectives for today. I'm not gonna lie, I don't typically do learning objectives, but I feel like it's appropriate for a professional presentation today. So we're gonna learn about the structure of the data standard and some of the data elements within it. I'm not gonna cover every single element, but just kind of talk about the components, especially ones that we use a lot, to understand how it works, how we use them. Gain an understanding as to how the standard affects your EPCR documentation. Learn where to find some resources to assist in further understanding the standard and the EPCR documentation. We'll do an overview of the history of NEMSIS and learn where your data goes and what it's used for. I know that's something that when I was a clinician, I filled out an EPCR, completed it, sent it off. We used it for QA purposes. I didn't know anything else beyond that. And then I learned about NEMSIS and that the data is used for a whole lot of things. So starting out here, so what you see, this is basically like the cover page or home page when you go to look into the data dictionary on the NEMSIS website. Shows what version it's covering. So this particular one is version 3.5.1, which is our newest version. And then just the last revision date as well. Um, So remember, data dictionary is where you will find all the data elements contained within the data NEMSIS data set, explains the requirements of each element, provides definitions and resource links, and also other variables that might be contained within it. And also explains the data element construction. So to find the data dictionaries, you're going to visit the NEMSIS.org homepage. Hover over technical resources and click on data dictionaries and access D. So here you're going to find, currently we have three versions listed on here, version 3.5.1, 3.50, and 3.4.0, which is the older one. Each version typically has, it has its own data dictionary. You're going to have a web version and a PDF. For the older versions like 3.40, there's only a PDF available. The web version is typically easier to navigate. However, I always recommend downloading the PDF version so you always have that available, just in case for whatever reason our website may not be working, because that does happen from time to time. Any of us who are involved in software, we understand that. So clicking on the web version, this is what you're going to see when you first come into it. Again, it's kind of that home cover page. The left navigation bar shows all the different data sets and element groups. So you can click on those to see that, as well as an overview of the number of elements and their usage. And then the summary page breaks down all those different aspects of a data element, explains the construction of it and whatnot. And that's what we're going to really cover uh, in this presentation so that we can understand those a little better. So within the current 3.5.1 standard, and just because this is the newest version, sorry, that's the one we're going to focus on today, there are a total of 652 data elements. Now, when someone hears that, I can understand holy buckets. That seems kind of overwhelming. But understand that those are broken down in a whole lot of different ways. And so let's start working on that, and hopefully it'll make a little more sense. So there's essentially three different data sets within the data dictionary. Okay. So we have the DEM data set elements. There's 156 of those. These are essentially the demographic information for the EMS agency submitting that EMS record. So, and these help to identify the agency and unit, verify that's who it is submitting the record, so that it's not some weird lost missing record coming out of nowhere. A lot of these elements, as the clinician, when you're completing your EPCR, you're likely never to see these. Some of them maybe will show up, let's say, at the beginning of your shift when you log into your EPCR software and you're going to log your unit number, the personnel that's on that crew that day, maybe your equipment, things like that. But typically, this won't show up every time you open and you run a report. The next set is the state data set. There's 47 of these, and these, similar to the DEM dataset elements, simply help identify the state that's submitting the record. And again, helps to verify that it's the correct state, that there is a state that exists with the record. And it also contains things like facility IDs. So when we're completing our EPCR, you're not going to see those IDs typically. You're going to see the actual name of the facility, and it helps to correlate that back to make sure that it all gets submitted to the right places so that it can go to the receiving facility, and then that facility can be identified in the record as well. And then the EMS data set. And this is the meat and potatoes of it all. These are going to be the elements that you're going to see most often in your EPCR. And when we refer to elements, when it comes to the user interface documentation side of it, think of an element as a field. Typically, that's what we refer to it in the EPCR side, right? In your report on completing fields. That's basically what an element is. So there's 449 of these. And this collects the information about the event. So what's the reason for the call? How did the patient present? What did you do on the call? What happened with the patient? Can include patient name and other demographics. It even includes your narrative. That is an element. Each element or each data point, sorry, is its own element. So you have systolic blood pressure is one, diastolic blood pressure is another. So kind of knowing that you can understand a little bit more why there's so many elements. We want to be able to separate out all those data points for better analysis of that data later on. And then again, so we'll just show that navigation bar in the EMS data set. This is the one we're talking about. There's a few that aren't showing in this particular slide, but we'll kind of cover what's all there. So going back to this, using our navigation bar, go into the grouping, we're going to click on the e-disposition. I've worked with this one quite a bit in the last year, so I tend to go to and reference this one. You'll see all the elements within that grouping, and each element has an element number, an element name. You'll see some boxes, different colored boxes next to it that have different indications. The legend at the top explains some of those. And then to the left of each element, there's some numbers, a ratio, and that's the recurrence. And so we'll go over that as well. So first, let's talk about all the little boxes and what they mean. So if it's a red box with an N in it, it indicates it's a national element. These are the elements that are collected at the national level or to the national repository. Your state also will collect them, but only the elements with the red box and the N come to the national repository. So that's what, if you submit a research request to the NEMSIS TAC and we send you the research data set, it's only those elements that are in it. The yellow box with the S, that's a state element. These are collected at the state level. These do not come to the national level. If there's a purple box with a D, it indicates that that element is deprecated. So this will still exist within the XML, and it is slated to be removed um, in a future version. And then also the gray boxes, so there's optional elements. So the gray box with the O indicates an optional element. It's not collected at the national level. It may be collected at the state level or agency level. Um, this is not a level of the data element, but a usage. But it kind of falls into the level as well. But obviously you can see more gray boxes. So let's go ahead and discuss what those mean. So the gray boxes are usage. You can have mandatory, which means it must be completed, does not allow for not values. You can have optional, as we discussed, which does not need to be completed and does allow for not values. Now, obviously, with the optional elements, there's some caveats. Your agency might require it. There's required, which means it must be completed, but does not allow for not values. And then E, which it's a little weird that it's an E instead of another R. But these are recommended. So again, does not need to be completed and allows for not values. So think of destination transfer to a name, right? You're not always going to transport a patient, so it wouldn't make sense that you always have to complete that element, but it needs to be in there because we have to have it to record that data. All right, and then coming to this table here, just to kind of show how the usage of the elements breaks down. So in the EMS data set, there's 21 mandatory, 130 required. Recommended, there's 61, and then there's 237 optional elements. So you can see that there's actually quite a few of those elements in the EMS data set that you may not even use. All right. Moving along, we have the banana colored boxes. I didn't really know what other color to call it. It kind of looks like banana to me. So there's going to have different letters. So a banana box with an N, that allows for the use of not values within that element. And we'll discuss not values a little more in a little bit here. The L means it's nillable, so the element can accept a blank value. Often your software will auto-populate something in there when it exports, however. A C, that indicates a correlation ID, just helps to correlate the groups and elements together, so everything kind of talks to each other properly. Some have that, some don't. The box with a P, that allows for pertinent negatives, and we'll discuss those a little bit more as well. Understand that when we use pertinent negatives within the data standard, that's not things like patient not vomiting, patient does not complain of chest pain. It's a little bit different than that. Just to cover some of the other ones you might see, there's U, which allows for UUID, I, which is custom element ID, T is for timestamp, and then G is for procedure group correlation ID. As far as clinicians are concerned, these really don't matter when it comes to our documentation. A lot of this is kind of the background stuff, how things work there. All right. And then recurrence. So we have four different types of recurrence. The first one is a one-to-one. So it means that this element is required, can only occur once. And we'll explain each of these a little bit more detailed in just a minute. 0 to 1 means the element is not required and can only occur once. 1 to many, which means the element is required and can only occur, can occur multiple times. And zero to many means it's not required and can occur multiple times. So the one means required, zero means not required on the first part of that ratio, and then the second part, one or many, dictates how often it can occur. So looking at the e-procedures 3, which is procedure, which clinicians document often, has a one-to-one recurrence. So it must have a value selected when you're completing your PCR. And that can be a not value in this particular instance. You don't always perform a procedure, right? Um, so you can choose only one procedure for each field or tab. So what that means is when you open a procedure in your EPCR, you can enter one procedure. If you wanted to enter another procedure, you have to have another procedure field. So you can't open one procedure tab, if you will, and enter every single procedure that you did. That would have to be a one-to-many in order to do that. 0 to 1, complaint is a good example of this. Um, so it does not have to be completed, though it probably should be in a lot of circumstances. But if you don't have patient contact, obviously it wouldn't make sense to complete it. And you can only enter one thing in there. Now, this is a free text, so you get to type it out, but you can only have one complaint per field. One to many, other associated symptoms is a great example of this, right? Our patient can have many different symptoms in addition to whatever the primary symptom is. Um, so it does want an answer, but you can put a lot in there and you can put many, many different things. Maybe show an example like a drop-down list, multiple choice, right? And then the 0 to many, so medical surgical history, great example of this. Patient can have a pretty extensive medical history, so we want to try and document as much of that as we can. However, maybe they don't have medical history, then we don't have anything to document there. All right, and moving on. So attributes, these are the values that we're going to select, right? And they can be several different things. So our not values, our pertinent negatives, external codes. So ICD-10 codes, SNOMED CT codes, RX norm codes. We use these a lot in the documentation, probably don't even realize it. But when you're selecting things like medications or that patient history, locations as well, location type, those are all using external codes from these different libraries. We have some predefined values in some elements. There's free text as well, obviously things like narrative, patient name, and then other things like your facility IDs, UUID, but a lot of these we don't really see, right? So first let's cover not values. There's a few different types. Not values where permitted um, are meant to document that that element was not applicable to the situation or was not completed or is not collected by your state or agency. So you have not applicable indicates that the element is not pertinent or applicable to the current situation or call. Pretty self-explanatory, makes sense. You have not recorded, and this is for when the element it may be applicable to the particular situation, but it was left blank for any given reason. Maybe you just couldn't get the information, um, forgot, whatever. Your software should auto-populate to not recorded if that field is left blank prior to that document being exported. And then not reporting. So this should be used when an element is not collected by the EMS agency or state. So if it's in your EPCR, but it's not something you guys do, not recorded would be appropriate for that. Pertinent negatives, there's quite a few different pertinent negatives. They're not allowed in every element, only some elements. But let's talk about a few examples. So we have contraindication noted, exam finding not present, no known drug allergy, and symptom not present. So these are all pretty self-explanatory. You can understand how these would be used in certain situations, right? Um, you're not going to record broken leg if they don't have one. Exam finding not present, right? Use them in situations like that were allowed. We have external codes like I talked about. So you have ICD-10 codes, and those have various things, diagnosis codes, location type codes, a whole bunch of different things come from ICD-10. I could list them all, but it would take us days and days as there's tens of thousands. SNOMED CT codes and RX norm codes, these can be for procedures or medications. Um, we take that all from those libraries, and it all gets linked into your reports. Um, Understanding these codes, though, sometimes we might be completing our EPCR, and let's say for location, we're trying to find the best fit for what the type of location is. And we get kind of these, we might say kind of goofy titles, right? Like private establishment, parking lot, I don't know, something like that. Those all come from that ICD-10 location. So we try to use the name as accurate as possible to what it is in that library. And then it's got a code link to it as well that actually gets put into the XML document that gets exported out. So here's an example of SNOMED. And then this one has both SNOMED and RX norm codes. So sometimes it can pull from multiple libraries for one element. All right. If some of these lists seem extensive, you can visit the NEMSIS website for the defined lists and suggested lists. And I will share a link to that in the chat before we're done today. So I want to provide you all with some resources. Predefined values. These are where external codes or free text maybe don't allow for the best data collection or don't really define the situation very well. So a good example is our EDIS position 28, your patient evaluation and care, right? We want kind of specific values for this. So patient evaluated and care provided. That's pretty specific and obvious versus just typing in some random stuff. We took care of the patient, right? Like that doesn't necessarily mean anything to external data users. Um, and also makes it difficult, right? If we don't have that standard to compare to other places. And then you can have free text. It's where codes aren't used. Predefined value doesn't make sense. So these are going to be using things like patient last name, your narrative, that's a free text element, and also patient complaint, which we had mentioned earlier. And one other thing I want to point out with like free text elements and similar ones is the constraints. They're highlighted with the red box. So it basically says, okay, you have a minimum of one character is allowed, and then there's a maximum amount of characters as well. So for last name, maximum of 60. For narrative, a maximum of 10,000 characters, which is something like 3 to 4 pages single spaced. For complaint, a maximum of 255 characters. So that allows you to be able to document what the patient told you their complaint is, right? All right, so let's walk through an element, then knowing what we just talked about. So our medication administered, great element to use. So the arrows are showing it's a state and national element. It has a usage of required, allows for pertinent negatives, not values, and is nillable. So you wouldn't have to have anything in there if you didn't give a medication. And then a recurrence of 1 to 1. So it wants a value of some sort in there, but it is nillable, so you don't have to have that. But when it exports, it has to have like the not recorded in there. And then you can look underneath that top part, and this is going to show you the not values allowed, pertinent negatives allowed, the code types that are being used. So here's RX norm and SNOMED CT. And then this one's unique in that it also has, it's not necessarily a predefined list, but a suggested list of SNOMED codes for documenting blood administration. We're trying to find a way to make that more uniform so that it's easier to be able to evaluate blood administration throughout the country amongst EMS agencies. And then if you look underneath that, you'll see associated validation rules. So the rules, right? These are validation rules. There'll be the last thing listed within that data element. And there's a couple different kinds. We have errors and we have warnings. So understand that these are not a validation score. Your software vendor or your state might assign a score to each element, which might be visible in your EPCR when you're documenting, just to help make sure that you get a complete and quality EPCR completed. However, the NEMSIS standard doesn't apply a score. You just have the errors and warnings, and these just help to kind of tie elements together, make sure the data structure is correct, and different things like that. So a good example of warning, it may relate to a serious clinical condition, but it doesn't disallow for exporting your document, whereas an error may simply indicate that there's a problem with the data structure, but errors will not allow for your document to export. So let's talk about that more. So an error relates to the data structure or file integrity. If there's an error within your EPCR, when you try to export, it will fail to export from your agency system to your state or the national repository. In order for that to export, there will need to be a correction made. A warning, so if you have a warning, indicates that maybe something's not completed in the element, it's completed incorrectly, or it didn't follow an established rule. If there's a violation, your document will still export to your state or to the national repositories. However, efforts should be made to correct any violations and help to ensure that they don't occur. Again, it makes for better quality data in the end. Some states and agencies may develop additional rules for an element or upgrade a warning to an error. It is not recommended, however, that national rules be modified just because it can potentially cause validation and export issues. You can check what your state's validation rules are via the NEMSIS website, and I'm going to show that to you guys toward the end of the presentation here, where to find that information. Okay. Oops, sorry. So here we can see a couple validation rules near the bottom. So the first one is an error. It says when other associated symptoms is empty, it should have a not value or should be omitted if an optional element. So that's relating to the data structure. So when you want to go to export that, it has to have something in there, right? Even if it's a not value. Whereas if we go down to the warning, it says when other associated symptoms has a not value, no other value should be recorded. So that's simply saying if you're going to choose a not value, you shouldn't have, you know, associated symptom of chest pain in there, right? It should only be that one not value. But if you are in violation of that warning, your record will still export. So hopefully that all makes sense to everybody. Let's go on to, I just made kind of a mock EPCR just to kind of show going through the process. This is not an official NEMSIS EPCR software. This is not available for anybody. NEMSIS doesn't endorse any specific EPCR software. This was simply made using Microsoft Word just so everybody understands that. And I don't recommend using Microsoft Forms, I mean, for creating an EPCR. So if we start here, we see response mode to scene. We have a drop-down list, a few different options. So we initially clicked emergent. Notice I can't click more than one option. It can only accept one. However, response mode descriptors, I can select several, which is appropriate, right? Because you may have several different possibilities when responding to a scene. Type of service requested. Again, it's multiple drop down, but I can only select one at a time. So that would be one of that one-to-one recurrence, right? Incident location type similarly. And this is showing like how the ICD-10 codes, how the location type might be listed in the words. So street, highway, and other paved roadways. Our unit disposition. So again, here I can only select one option. Medication administered. So this is a one-to-one. I can only pick one option. We didn't administer anything, so we're going to choose not applicable this time. Patient last name. This is one we discussed as a free text, so I can type in what the name is. And then transport disposition. Again, we can only select one option here. For this particular scenario, no transport. And as you can see, it's only letting me click one. And so that's what it's going to kind of look like. Now that you kind of saw what that data element structure looks like, how it all ties into your EPCR, hopefully that kind of helps to understand why can I only pick this? Why can I only pick that? How come we have to do these ones instead of those ones, right? Hopefully that all kind of ties everything together more. All right, to find then your state resources, go to the NEMSIS homepage, scroll down to the green map, and then click on your state. So I'm in Minnesota, we're going to pick Minnesota. And if you scroll all the way down to implementation tools and click on state data set, the left navigation bar here gives you the different things to look through. So state collected elements, certification levels, procedures permitted by state, protocols, EMS agencies, etc. And you can find the validation rules within the different elements within the state here. And it'll show you all the different state collected elements as well. So moving on, so we have a brief video. And then again, like I said, I'll drop some links in the chat before we leave here to give you some more resources. So this will be our intro to NEMSIS video. And I'm going to play this and just kind of sit back and listen.
NEMSIS, better data, better care.
Yeah, that's working.
The National Emergency Medical Services Information System, also referred to as NEMSIS, is a standard that creates consistency in EMS data collection and reporting throughout the nation, and provides for states and agencies to compare data apples to apples. Additionally, the standard helps to inform evidence-based changes to EMS guidelines and policies. NEMSIS isn't just data, it's systems, healthcare, physicians and nurses, data specialists and technicians, partnerships, patients, and clinicians like you.
Prior to the inception of NEMSIS, state and local EMS systems varied in their ability and version of collecting patient and systems data. This greatly hindered their ability to share information, innovate, and improve to respond to the changing needs of EMS and pre-hospital patient care. In 1973, the Emergency Services Act established many guidelines and requirements for EMS, including requiring EMS data collection or documentation of EMS services based on 15 essential components of EMS, as identified by the Department of Health, Education, and Welfare. The National Highway Traffic Safety Administration's Office of EMS continued to develop national data reporting and field practice standards, leading to the Uniform Pre-Hospital EMS Dataset in 1994, the EMS Agenda for the Future in 1996, and becoming the funder and administrator of the National Emergency Medical Services Information System upon its founding in 2001. In 2003, the NEMSIS Technical Assistance Center, in partnership with multiple stakeholders and NHTSA, developed a national data dictionary and dataset. 2005 NEMSIS version 2.2 data standard is developed and includes XML as the standard data transfer language. Work continued to develop new standards, leading to the release of version 3.5.0 in 2019, improving the robustness of EMS documentation and data collection. In 2020, the NEMSIS Technical Assistance Center developed a weekly report detailing the impact of the COVID-19 pandemic on EMS response, showcasing the ability of the NEMSIS collected EMS data to monitor public health events in near real time, and helping further demonstrate the importance of a national EMS data standard.
In 2024, 54 U.S. states and territories participated in the NEMSIS Standard. This included over 14,000 EMS agencies and a total of over 340 million records submitted since its inception. The annual number of records submitted to NEMSIS continues to increase, as does the number of states and agencies participating. 2024 alone saw more than 59 million records successfully received by the National Repository.
How does it work? You respond to an EMS activation. Once you've completed the EPCR for that event, it's submitted to your state's data repository. At the same time, that EPCR may be submitted to the facility that you delivered the patient to. It's then submitted to the National EMS Data Repository. The record is stored in the National Repository, where the data is cleaned and made available to the public for research purposes. With continued updates to the standard, facilities are now able to report outcome data back to your agency, the state, and ultimately the National Repository. The data has been used in hundreds of academic and EMS industry research papers, federal health surveillance studies, and to develop many performance measure and health surveillance dashboards.
Remember, NEMSIS is a standard, not a regulation. Participation in NEMSIS is voluntary. However, your state or territory may have policies that dictate agency participation, as well as what types of agencies must comply and submit data. The NEMSIS Technical Assistance Center, also referred to as the NEMSIS TAC, is the integral group of professionals that help to make NEMSIS possible. The TAC consists of biostatisticians, data analysts, technical and EMS experts, educators, and many others. Many are even former or current EMS clinicians. They are responsible for the maintenance of the National Repository and the NEMSIS Data Standard. The TAC provides guidance and assistance to states, EMS data software vendors, and EMS agencies to meet the NEMSIS standard and provide the best quality data. Among the many responsibilities of the NEMSIS TAC, they work with various federal, state, and local level stakeholders and individuals to continually review and revise the NEMSIS standard to meet the ever-changing needs of the EMS industry.
Various private, public, and academic researchers use NEMSIS data in their research projects, as well as many federal, state, and local government entities. Some of these recent projects have included evaluating the impact of various weather events on EMS utilization and resources, the usage and efficacy of blood products in pre-hospital emergency events, and the efficacy of pre-hospital EMS care provided to pediatric out-of-hospital cardiac arrest patients. For a list of more publications using NEMSIS data, scan the QR code. As stated earlier, the NEMSIS TAC develops and maintains various public health surveillance and performance measures dashboards. A few of these dashboards include Drug Overdose Surveillance Dashboard, Heat-Related EMS Activations, EMS Performance Measures, Public Motor Vehicle Crash, Public STEMI Dashboard, and many more. Scan the QR code to view these and other NEMSIS public dashboards. Many organizations and agencies have leveraged NEMSIS data when applying for local, state, and federal grants, receiving awards for such applications as using drones to assist in the delivery of pre-hospital emergency medical care in remote areas, reduce highway crash mortality rates through improved response times, patient access times in public education, and implementing the use of blood products in pre-hospital emergency care.
NEMSIS has been so successful and impactful in the United States, other countries are exploring adopting similar models, with some having already implemented their own versions. Do you have any NEMSIS-related questions? Do you want to do your own research using NEMSIS data? Do you have a suggestion for a change to the NEMSIS standard? Scan the QR code and submit a ticket to the NEMSIS Help Desk.
NEMSIS starts with EMS clinicians like you. Through the passionate work you do and the diligent efforts of collecting EMS systems and pre-hospital patient care data via your EPCR, you help to continue to make NEMSIS the incredible success it is and lead the EMS industry into the future. To all of our EMS industry partners, we thank you.
All right. So that was kind of the intro to NEMSIS. And to express the importance of the data that is collected by all of our EMS clinicians out there is incredibly valuable. There's always national level, state level initiatives going on, and a lot of us don't know that while we're running on our EMS runs, completing our reports. That data gets used for all those different things. Blood products was mentioned more than once in the presentation. It's a huge national push right now, right? We know that getting blood to patients who need it early is incredibly beneficial, but we can't know that if we don't have a standard of reporting it and a means of being able to evaluate the efficacy of it, right? And that's really what the standard is about, making sure that we're all on the same page, we're all collecting, the same or very similar data so that we can use that to really drive the EMS industry forward and keep pushing forward like we have. We got to remember, EMS, as far as industries are concerned, is still pretty young. Just started in the 60s. That's not that long ago. When you consider the fire service as a whole or police as a whole has been around for hundreds of years in some form or another, right? And we've come a long ways and it's great. And a huge thing that helps to assist with that is that data collection, that ability to be able to analyze that data, and see where we're doing well, where we could improve. And sometimes it's not even about improving, but hey, this stuff's really great to use and it's going to be beneficial for the patients or the clinicians, right? Um, and it can also help us evaluate gaps in the industry. Maybe you're one of those agencies where you're really struggling to find resources, so that can kind of help with that as well. You can compare to other agencies using the same type of data, right? And that's really what this is about. So now that we've covered all that, I know it was kind of a lot and quite quickly. Um, Again, we thank you very much for attending. If anyone has any questions, please, now would be a great time. And then I also will drop those links for some resources in the chat here as well, as I had promised. So if you give me just a minute with that. And Chris or Lori, I didn't see, was there anything in the Q&A before we got started or kind of while we're going here?
We've been answering as we went along. Let me double check. I think we're all caught up. Yep, I think we've answered everyone's.
Okay, excellent. All right. So the links I put in the chat, just so everybody knows what they are, what they're for, if you haven't seen them before. So there's a link that brings you to the defined lists and suggested lists page on the NEMSIS website. And so that has for like procedures, for medications, a couple other things, a pretty broad list, but kind of a shorter list than the maybe 1,000 codes you might see in ICD-10, right? So it kind of helps to be able to narrow down so that your clinicians don't need to feel overburdened by having a drop down of, again, like 1,000 different options. That's a lot to choose from. There's also a link for the data dictionaries page, and then also the extended data definitions. And this was done in collaboration with NESEMSO. I think it's a great resource. And this just kind of helps explain, especially specifically for new elements, gives definitions to maybe the different values that you're going to have in that element to choose from. The e-disposition elements is a great example. There's a whole bunch of them in there with definitions for each of the values. If you read through that and then you start documenting those in your report, I think it really helps it come together and make a lot of sense and solidify a lot of the concepts there. So, all right. If no one has any questions, I think that's the end of our presentation today. I would like to remind everyone that we have our annual meeting coming up in August. Please feel free to visit our website and register for that if you're interested. We do have a forum that is specifically for the agency level on the first day during our breakout forums. It's a great opportunity to be able to have some good discussion, help find some solutions, help give others some solutions, bring up some new ideas that that NEMSIS can start working toward, and different things like that. So, all right. Well, thank you everyone for attending. We're always very grateful to have people on our at our public trainings. Everyone have a great day. Stay warm or cool, whichever you happen to need today.